Hi everyone, welcome back to my channel. Let's talk about part 2 of analysis and understanding. Remember that we are still on the trick, the tips and the strategies on how to answer nclex exam. In analysis and understanding part 2, 1. Identify associated words. Look for words in the answers that is closely related to the words in the question stem. This will help you to give you a clue. This will give you an idea in order to pick the correct option, in order to pick the correct answer. 2. Assume ideal condition. Assume ideal conditions. Example, some facilities does not have necessary equipment, does not have necessary resources, inpatient care and inpatient treatment. But in nclex, just assume that the facility has every equipment, every resources for patient care. Assume that all the facility has accessible equipment, has available equipment for the patient care, because this will allow you to focus on the best possible care without considering the real world limitation. nclex word is different from the facility or hospital practice. Do not take whatever thing they're practicing or they're doing in the hospital to the nclex. Yeah, it is a different thing. 3. Go back to basic. Anytime you face with a difficult question, draw upon your fundamental. Think back to your fundamental knowledge, especially if the question is unfamiliar. If you are unfamiliar with the question, think critically. Think back to your fundamental. It will help you to pick up the correct option. Yes. Think back. Think back to your fundamental, because your fundamental is your basic. It is the foundation of your nclex exam. So anytime you are facing with a difficult questions, you have to think back to your fundamental knowledge, which will help you to pick up the correct answer. 4. Beware of absolutes. Be caution using these words called absolutes, like always, never, all, or none. Sometimes those words are incorrect. Those words are not the correct answer, because few things in healthcare are absolute. So anytime you come across any options that has all those absolutes, never, always, all, none, be cautious. Don't be quick to select those options, because it might be the incorrect answer. So be aware of that. Number 5, focus on the patient needs. Sometimes the correct answer will focus on the patient need, the prioritization, the immediate care to the patient. So the correct answer sometimes focus on the patient needs. So anytime they ask you a question, you have to pay attention depending on the condition of the patient. If it is a life-threatening condition, you have to pay attention before you can be able to pick the correct answer. Guys, I will stop here for now. Awareness is the key. Do not get it twisted. Remember, you can, you will, and you must pass your nclex exam. Do me a favor to subscribe, share this information, like and comment. See you guys in my next video. Bye for now.